Prostate cancer can be diagnosed via different pathways. There is always the regular pathway through GP referral when they test people for their PSAs and refer them to the secondary care, or there is also the incidental pathway when patients have been scanned for different other parameters and incidentally found to have abnormality within the prostate or the area near to the prostate. And the third pathway is when people themselves seek to ask for investigation if they have a family history or a friend who have been diagnosed with prostate cancer. The commonest way is PSA, rise, refer to the secondary care for further investigation, where an MRI scan is conducted and thereafter a biopsy taken to confirm the evidence of prostate cancer. In most cases, it has no symptoms, actually. People do have it tested for routine, non-symptomatic reasons. In very minor cases where patients have some waterwork symptoms, they get tested for a PSA and they found these PSAs to be high, hence they have the process of being referred and diagnosis of prostate cancer. But in the majority of cases, the cancer do not produce any symptoms unless it is so advanced and it's becoming a big cancer within the prostate gland that's causing a compression or affect the surrounding structures that can lead to the symptoms. As it's in majority of cases diagnosed incidentally, there isn't many symptoms, but symptoms of advanced prostate cancer would include obstructive features, i.e. patient can't pass urine in the proper format, and there is a sudden new onset reduction in their ability to pass urine in the proper format and or urine retention. There are those who present in the form of fractures to their bones secondary to metastasis from the prostate cancer. There are those who present from irritation to the neighboring structures, like a bladder secondary to extension of the prostate cancer. So in majority, these are the commonest things that people can present with. And or, as I said before, it can be diagnosed as part of investigation for other types of abnormality, like bowel, for example, where an abnormality detected near the prostate. Yes, it is. Actually, there's a lot of advancement in medicine in the current era, and there's a lot of treatment options available for early diagnosed prostate cancer. In addition to the standard ones like radiotherapy or surgery. And as a matter of fact, in some cases, when there's early diagnosis with low risk prostate cancer, they can be monitored for quite a good length of time before they need any treatment. Stages of prostate cancer start from the localized stage, when the cancer is localized either to half of the gland or both sides of the gland. Second stage is when the prostate cancer starts to invade to the surrounding structures, or more or less into the neighboring structures, let's put it that way. And that includes the seminal vesicles. And then stage 4 or the advanced stage can involve the neighbor structures like the bladder or the bowel. Then you have the lymph node status, which can be added to that particular staging. And that's part of what we call the TNM staging, or the tumor nodes and metastasis staging. And then you got the status of the bone, which can be added again to the above two stages. These are helpful to understand the cancer to the extent the cancer has metastatic to or has spread to, and then to help patient and the clinicians advise on future treatment. Localized prostate cancer can be treated with variable modalities depending on the patient age and the patient views and type of treatment that the patient would like to or have agreed to have, from localized high intensity focused ultrasound scan, which used to treat a very localized small focus of cancers, to those who need surgical intervention in the form of removal of the prostate glands, or those who benefit from inserting of radioactive seeds into the prostate, or external beam radiotherapy, i.e. radiating the prostate from outside.